Good evening and welcome to hashtag Day 43, the Black Maternal Health Webinar. Thank you all for being here tonight. My name is Cheryl Hilton, and I am the president of the Waterbury, Connecticut chapter of the Links Incorporated. The Links Incorporated is an international not-for-profit corporation established in 1946. Our membership consists of more than 16,000 professional women of African descent in 292 chapters, 41 states, the District of the District of Columbia, the Commonwealth of Bahamas, and the United Kingdom. It is one of the nation's oldest and largest volunteer service organizations. This year marks 48 years of continuous service by our chapter to the Waterbury community. We've been successful in continuously providing information and access to many things, such as college and work readiness programs, health fairs, timely information on topics such as mental health, physical health, COVID-19, and conversations with law enforcement. We have hosted Senator Christopher Murphy, who spoke about the cleanup of the brownfields and the creation of modern manufacturing employment here in Waterbury. We've also given multiple renewable scholarships and book rewards to deserving Waterbury youth. Tonight's event is the beginning of what we anticipate being a long and fruitful partnership surrounding the topic of maternal health. With our key partner, Bridge to Success. Our additional partners include long-term national partner, American Heart Association, also Stay Well Health Center, Greater Waterbury Health Partnership, and St. Mary's Hospital, which is part of the Trinity Health Network. Our moderator and member, Dr. Marcia Tejeda Smith, along with esteemed panelists, Dr. Edward James, Neonatologist, Dr. Veronica Pimentel, Maternal-Fetal Medicine Specialist, Farrah Etienne, Doula, and Chelsey Harris, Director of Early Care and Education for Bridge to Success, and parent. We're all here to share with you their knowledge, insight, and experience. And with that, I would like to introduce Althea Marshall Brooks, the Executive Director for Bridge to Success.
Thank you, Cheryl. Good evening, everyone, and welcome. I'm so excited to see you all here. As Cheryl said, I'm Althea Marshall Brooks, Executive Director for Waterbury Bridge to Success, or BTS, as some of you know the organization. Bridge to Success was established in 2010 as the state's first Cradle to Career initiative. In partnership with the Waterbury community, Bridge to Success envisions a city where all stakeholders, particularly BIPOC, Black, Indigenous, people of color, can't assume folks always know what BIPOC means, but particularly Black, Indigenous, people of color, are able to enact change that moves us collectively from surviving to thriving in a racially equitable, just, and liberated city. Cheryl had shared with you the collaboration that Day 43 brings together, the Greater Waterbury chapter of the Links, the Greater Waterbury Health Partnership, Trinity Health of New England, the American Heart Association, Stay Well Health Center, and the generous support of our partner, the Connecticut Community Foundation. Hashtag Day 43 strives to create solutions to combat Black maternal and infant mortality and to support an all-around equitable environment for all women, birthing people, and their babies to address the disparate outcomes they experience as Waterbury's BIPOC birthers and babies. By transforming systems, hashtag Day 43 will raise awareness on Black maternal health in the city of Waterbury and beyond through training, research, technical assistance, policy, advocacy, and community-centered collaboration. We are excited to kick off this exciting and transformative campaign. We have a panel of outstanding leaders in infant and maternal health, including the voice of a Waterbury mom. To get things started, I would like to introduce to some and present to others our moderator for this evening, Dr. Marcia Tejeda Smith. Dr. Marcia Tejeda Smith was born and raised in East Harlem, New York. She graduated with honors from the College of Liberal Arts at Boston University with degrees in both biology and psychology, and she continued her education at Boston University and graduated from the School of Medicine. Determined to give back to the community where she was raised, she completed her residency training at Harlem Hospital, Columbia University affiliated program in obstetrics and gynecology, where she received extensive experience in general and high-risk obstetrics and gynecological care. Dr. Tajeda Smith started her career in Waterbury at St. Mary's Hospital, where she provided care for patients at their women's clinic. She did this for several years while building a private practice. In 1999, she and partners formed a larger partnership with several OBGYN doctors in Connecticut, becoming Physicians for Women's Health USA. A leader in her field, she was the chairman of the Department of Obstetrics and Gynecology at Waterbury Hospital for several years. Dr. Tajeda Smith has cared for the women of Waterbury and the greater Waterbury area for over 30 years. Driven to provide excellence in medical management for all women, she has been at the forefront of providing skilled gynecological and obstetrical expertise. I'd like to present to you Dr. Marcia Tajeda Smith.
Thank you so much, Althea. Thank you once again for joining us all tonight. We are so excited to engage in this pertinent conversation on Black maternal health. We have a series of pre-developed questions for the panelists that were pulled together from key topics the community members want to learn. At the conclusion of the panel discussion, audience members will have the opportunity to use the chat on Zoom and Facebook to ask questions. A gentle reminder, this meeting is being recorded, and we are also streaming this live on Waterbury Bridge to Success Facebook page. Our team will be screening questions for the end of the panel discussion. I will ask one question per panelist, and then we will have open dialogue. First question. Black women are 2 to 3 times more likely to experience a pregnancy-related death. Poor maternal health outcomes are rooted in societal disparities and lack of access to adequate and equitable care. Day 43 is the 6-week mark that is recommended for a postpartum checkup after giving birth. Many mothers do not return for their postpartum checkups. Additionally, studies have found a great proportion of pregnancy-associated deaths that happen are between days 43 and 1 year postpartum. Panelists, why do you think that is? And how can we improve access to quality healthcare for Black women?
I think a big part of the why is the systemic racism within the medical community that needs to be addressed. Mm-hmm. There's a preconceived notion that women of color are somehow stronger or are able to tolerate more pain, mm-hmm. or are not able to readily identify what's going on with their bodies. And so when we're in these spaces where we're not, we feel our words don't have merit, what we're saying it doesn't matter. I think that drives a wedge of uncomfortability between the doctors and the patient. And just speaking from, personal experience as a mom of 3, for example, when I went in to have my second daughter, I was already familiar with giving birth and my body and et cetera. And I said to the nurse, I'm in a lot of pain. She's crowning. Can you please get the doctor? Mm-hmm. And she said, oh, you're fine. She didn't even look at me. Oh, it's just a contraction. Just breathe through it. Mm-hmm. Oh, she's not crowning. And it wasn't until my daughter's father lifted up the sheet and said, her head is coming out, when, everyone went frantic and running for the doctor. And so the whole time I'm telling you what's going on, but you're assuming that I'm incorrect. And so I think that that's a big deal. And, and a time as traumatic as giving birth, which of course it's a beautiful time, but it's extremely traumatic, and it's a sensitive time. You're putting your life in the doctor's hands, you're putting your children's life in the doctor's hands. And if you feel that you're not valued and not heard, then, why would you want to go back to that? So I think that that's a huge part.
Good evening. I think that this is Dr. Pimentel. By the way, I forgot to add that I'm a Waterbury girl. I'm a Crosby graduate, and I lived in Waterbury most of my life. And so happy to be back home, virtually at least right now. So here we are, EA
Well,
Crosby.
that's great. That's great. I didn't know that. That's awesome.
But I would say that, there's definitely, it's not race, it's racism. That's sort of the motto that we're going by, meaning that there's no biological explanation for the differences that are happening. The racism is not just in the medical field, it's societal, and it stems back to the disparities that exist that have led to the differences that also put Black and brown women at disadvantage. So compared to white women, Black women are more likely to experience chronic problems such as diabetes, high blood pressure, heart disease, all of which put them at risk. And the rule of thumb is that if you enter a pregnancy healthier, you're going to end the pregnancy healthier. So the converse is also true. And then, so if you enter already with medical problems, you're going to need more care, more specialized care. So you have to have access to the specialized care to begin with, which so many Black women do not have access to. And then on top of that, yes, you have to be taken seriously and treated like a full human being. So, and many Black women or compared to white women, Black women are more likely to be uninsured or have Medicaid. And there's many issues that come with that, more likely to face financial barriers to care, and less likely to access prenatal care or quality prenatal care. So there are many different things that are compounding, that are coming from this whole history that's very much tied to the history of America, and we can tie it back all the way to racism and to actually slavery in America.
Yeah. Thank you, Chelsey and Dr.
Thank you for that response.
So what I was going to say is that just to add on to what both of you have said, which is great, I also want to add that there are a lot of social determinants to health, and racism is one of them, whether many providers want to acknowledge that or not. So let's go back before we even talk about conception. Let's talk about when a birthing body, before they decide that they want to conceive, is not receiving the proper adequate healthcare that they need, and they can't trust their provider. So if they can't trust their provider to say, this is my pain, this is what I feel, and this is what's wrong, then what happens is when they're pregnant, we've just compounded on a higher level issue. That means that this parent and this family now is neglected, and they don't want to return for that 6-week follow-up, because at that moment they can't identify and trust their own intuition to say that this pain that I feel might be a problem. Instead, it becomes, I'll just stay home and take an aspirin. So then we have now morbidity faced with the family that could have been prevented if there was a trust relationship between the provider and that family and that birthing body also. So that's why doulas are also so important, to create that level of companionship and community that can say, hey, you know what, this is how you feel. These are certain symptoms that are associated with how you're feeling. Maybe you should call that provider again, or maybe you should go in to check. It's okay to check. It's okay to go in, and it's okay to trust yourself in the process.
Dr. James? You're on mute.
I actually don't have a lot to add. I'm going to speak to some of this later in the program.
Okay.
But I think it was well covered by the other panelists.
Okay, very good. Next question. Peripartum cardiomyopathy is a heart disease of unknown causes that affects young women, often with devastating consequences. In fact, Black women have a 15.7-fold higher relative risk of peripartum cardiomyopathy than non-Black women. Chelsey, as a Black Waterbury mom and champion for raising awareness of Black maternal health, from your experience, what were some warning signs for peripartum cardiomyopathy?
So
And actually, Chelsey, before you answer that question, Dr. Pimentel, can I impose on you to just let everyone know what peripartum cardiomyopathy is?
Sure. It's basically heart failure that occurs either about a month antepartum, meaning you're still pregnant, versus sometime after giving birth that you don't have an explanation for. Like, it's not because of your high blood pressure, it's not because of some other condition. So it goes back to heart failure, where your heart is not pumping blood the way it's supposed to, and it can, if it's not treated appropriately, there's a high mortality rate. And it has a lot of consequences for the next pregnancy. The next pregnancy is considered a lot more high risk.
Is there a specific reason why Black women are at a 15.7 relative risk greater than the general population to have an experienced cardiomyopathy?
There's no genetic component. As we know, race is not genetic, correct? Black women definitely have higher risk factors for cardiomyopathy, period, because of the increased risk of hypertension, diabetes, obesity to a great extent in certain Black communities. Diet and lifestyle may have to do with that. But again, we always link it back to, and it's not because a Black woman doesn't want to be healthy. If you live, for example, in a neighborhood where you do not have access to gyms, or you cannot afford a gym, or you cannot walk safely in your neighborhood, or you don't have access to fresh fruits and vegetables, these are compounding things that come from society that put you at higher risk for these conditions. It's a little bit more complex than that, but the idea is that you already come in predisposed to it, not because of your genes necessarily, but because of the lifestyle and the stressors that you deal with in a daily basis that are not conducive to living a healthy lifestyle.
That's right. Thank you so much for that. Now, Chelsey, can you talk about your experience? Thank you.
Sure, absolutely. So as you guys heard Dr. Pimentel say, peripartum cardiomyopathy, also known as postpartum cardiomyopathy, is a weakness of the heart muscle that does occur from your last trimester of pregnancy until about 5 months postpartum. So the symptoms do range from mild to severe to obviously fatal, with the fatalities happening most commonly right after birth. But when you look at mild symptoms, it's just things like swelling of the feet and ankles and shortness of breath, which are very common in any third trimester pregnancy. And so those symptoms can tend to get overlooked.
Yeah.
But when you're looking at severe things, that's when you're getting like heart palpitations or low blood pressure, swelling well after birth, or shortness of breath well after birth. And like Dr. Pimentel mentioned, it does cause concern for future pregnancies going forward if you do have this condition and your heart doesn't recover to its full working capacity. And so I just think that it's important to bring awareness to it, because in communities of color, we hear very often, your high blood pressure, which is your preeclampsia. We hear the gestational diabetes, but very rarely do we hear about the postpartum cardiomyopathy.
Right.
And it is, a silent killer that's affecting our community in a tragic way.
Mm-hmm. Thank you. Dr. James, as a neonatologist, trusted evidence and informed decisions equal better health. Knowing that preterm birth or very low birth weight is a leading cause of death for Black infants, researchers set out to look at the care these infants receive at the start of their lives. Applying a racial equity lens to address maternal health disparities, can you lean in and share your views on the patient-provider relationship?
Yeah, thank you. Good evening, everyone. And thanks again to the organizers for setting this up and for inviting me to participate. Thank you. As a physician, one of the jobs is to educate. And I think that's clearly important, because as knowledge increases about healthcare, outcomes improve as well. So I'm going to start a little bit with infant mortality. I know this is a maternal health webinar, but obviously the outcome of a pregnancy is a baby. And since I'm a neonatologist, I'm going to focus on that and eventually get back to the question that Dr. Tejeda just asked me. So first of all, infant mortality not surprisingly, is disparate between whites and non-Hispanic Blacks and Hispanics. So the infant mortality definition is death in an infant from birth to 1 year. And for Black Americans in this country, it's about 3 times higher than the white peers. For Hispanics, it's about twice as high. So the same disparity we see at maternal level, not surprisingly, frankly, we see in the infants. We know that the causes of infant mortality include birth defects, prematurity, defined as birth less than 37 weeks. 37 weeks is 3 weeks prior to the due date, or birth weight less than 5 pounds. We know that sudden infant death, or SIDS, is on the list. Unintentional injuries is on the list. And certainly we've spoken to it just as it affects maternal health, structural racism, implicit biases. Biases definitely impact negatively the outcome of infants. When you look at the differences between white infants and Hispanic and Black infants in terms of mortality, the biggest factor contributing to that is prematurity. So there's a significantly higher rate of premature births in the Hispanic population, the Black population, as compared to the white population. And that directly impacts infant mortality. So again, you see these parallels between what happens with moms and babies. Not surprisingly, since the baby's inside of mom for the course of the pregnancy, it's not surprising that the health of the mom, as was alluded to by Dr. Pimentel earlier, affects the outcome of the baby. As far as prematurity is concerned, it's a complicated discussion. Not a lot is understood about why many women have premature births, but we do know, again, as was alluded to earlier, that there are certain health conditions that predispose women to delivering prematurely, and that contributes to this disparity in infant mortality. Improved health for the mom certainly will improve the health of the fetus, just common sense, and that's certainly true. It's in the question, and I certainly agree with that. Now, as far as what happens once the babies are born, that again is quite complicated. Lots of studies have been conducted to look at outcomes in the NICU based on ethnicity or race. And it's kind of a mixed bag, frankly, in terms of the literature. The bottom line in Connecticut is we have a small state. I'm familiar with all the NICUs in the state because it's a small state. And I must say, I think the medical care that's provided in terms of the treatments and the nuts and bolts of taking care of babies is pretty consistent. Where I think there may be some differences really relate to, I think, the way we communicate with our families. I'll give you a couple of examples. So one is visitation. So we know, for example, that babies in the NICU, it sounds sort of soft, but it's been demonstrated repetitively. So babies in the NICU who are visited by their moms, by their parents, gain weight faster, go home earlier, and do better long-term than babies who are not visited frequently by their mothers and their parents. So that's one. Breastfeeding is another huge one. I know we have a doula on the panel who can speak better than I can about breastfeeding, but we do know that both in the NICU and post-NICU, breastfeeding is a huge advantage in terms of medical outcome and long-term outcome. So I think those two things, it's our job as NICU providers to educate the parents regarding that. And I think there's an opportunity both before mom gets pregnant, during the pregnancy, and after to support these concepts so that the disparity may be improved just on the basis of that. Two additional things before I finish. One is mental health. I think that's been in the literature and in the media frequently. We know that Hispanic and Black people in general don't access medical health care compared to our white counterparts, our white peers. Just anecdotally, and I'm sure Dr. Pimentel sees it as well, and Dr. Tejeda probably sees it as well. The white women are very much involved in their mental health. They seek care, they seek treatment, and I don't see that happening with Hispanic and Black moms. And I'm no doubt that mental health has a significant impact on outcomes for babies. There's no doubt about that. And then lastly, many of these babies who leave the NICU have ongoing medical and surgical needs, and that requires follow-up. And that doesn't always happen, similar to the fact that women don't make it to their 6-week checkup. The same is true for infants. They don't follow up with their subspecialists to ensure that the ongoing problems they have when they left the NICU are cared for. And there are morbidities and mortality that's related to that. So I think there's an opportunity in the post-neonatal period to address outcomes. So it is a complicated discussion. We could talk about this for well over an hour myself, but I just wanted to give an outline as to what happens with the infants born to these moms. Thanks so very much.
Thank you so very much for that explanation. Next question. Shifting and advancing Black maternal health policy also includes access to resources such as midwives and doulas. Evidence shows that doula support during pregnancy and birth improves the health of both mother and babies, yet there are many barriers to accessing doula care. Farrah, as a doula in Connecticut, how can doulas promote anti-racist care? And how can local and state departments learn from doula model to improve healthy birth outcomes?
Thank you. Hi, everyone again. So doula care is very much comprehensive, and what state and local support teams can realize from that is that taking on that comprehensive care means doing an assessment, but doing an assessment with patient-centered, asking that family, what is it that you need? What are your concerns? It's not the same as a clinical assessment that is more assessing, okay, where do you live? What's your race? And pretty much sizing up a family based off of those factors alone. So the big takeaway is that doulas build community. And that's the most critical part of what doulas provide. Also with providing informational support where families feel comfortable to ask questions that they may feel maybe criticized by someone wearing a white jacket in a space where they should feel a little bit more comfortable. So like I said before, maternal health care improvement doesn't start at birth, nor does it begin at conception, and surely does not end at that 6-week checkup. So targeting it from a culturally competent perspective is what is the biggest takeaway of concern that can create better outcomes for Black women. And I want to add one more thing. It's also a matter of Black women not having to feel they need to show evidence for their pain, that they need to show, like, document, like, I feel this because I think I'm going to self-diagnose and I think this is what it is. So with all of those things combined, in fact, that could be a great takeaway for physicians and other team members to provide better support.
Farrah, how can patients access doula care, and how is it reimbursed? How are you paid?
So currently right now, there are a few available community programs available running right now where people can access doula care. One is the Office of Early Childhood Development. If someone is currently receiving any home visitation services right now, they can talk to their home visitor and receive free doula services through that. And that's very important for the community. There's also another program running, a breastfeeding support group, which is virtual, and it's also free. It's a combination of New Haven Healthy Start and Earth's Natural Touch, Birth Care and Beyond. So with that collaboration, there's a breastfeeding peer support group that is available to anyone. And with that support, the outcomes are amazing because you have support from someone that is pregnant, someone that wants to be pregnant, someone that has a 1-year-old, 2-year-old, and together that community, people can say, you know what, I'm feeling off about something. What does everyone think? So that's the bridging of the gap that happens, and that's essential. And that's another way to access doulas. And if someone else also is looking for doulas, they can go to earthsnaturaltouch.com also, which is a great outlet for that, which has culturally competent doulas as well. And
will you also go into the labor room with patients and support them during labor care?
So what doulas do, doulas provide prenatal, birth, and postpartum support. So currently you can have in-person birth support, but keep in mind, because we are in a pandemic, what's happening now is that families should check with each individual hospital policy in Connecticut. Do not assume that each hospital has the same policy, and it's forever changing. So something that is present now can change in a couple of weeks. So doulas are alongside clients. With the Office of Early Childhood Education, families are offered virtual support.
Okay, thank you so much.
You're welcome.
Next question. Black people also suffer from chronic stress just from being Black in America. We always must be aware of how we're dressed, how we're speaking, who we're interacting with, which is stressful to deal with on a very daily basis. Those type of stressors lead to what's called weathering or early health deterioration. Dr. Pimentel, as a birth and reproductive justice health professional, what are some factors that may put birthing people more at risk of developing health issues pre, during, and post-pregnancy? And what can expectant and new moms do to be advocates for their health?
Thank you for that question. And I have in part addressed it, I think, in the previous questions, but it's a very important one. I have to say that, yes, there's the stress from the hair, from how you look, from how you walk. I, as a Black woman born in the Cape Verde Islands, have felt that throughout my career, but that's a different stress from, I think, what Black American women face in America. And that stress comes from, there's actually this picture from this organization, the Perinatal Quality, where they compare the walk through life between a white woman and a Black woman. Like the walk through life is always convoluted, but the one from the white woman is a lot more straightforward. The one from the Black woman starts already with a heavy backpack that says, 246 years of slavery. And that is compounded by multiple things in the history of America, the history of segregation, the history of sexual violence, disproportionate incarceration, family separation, disparities in education. I can talk about that because I went to Crosby, but again, it's a different experience as somebody coming from another country than being here. The history of poverty, infant mortality. So all those things, right, you're carrying a heavy load. So the idea behind the stress is that why are you facing different health concerns? Again, if you live in a neighborhood where you don't have access to gyms, if you don't have access to good groceries, to food, if you cannot afford gyms, if you cannot afford mental health support, or you come from a culture that says no, mental health is not a problem, but and you don't learn that actually you need to deal with that. So all those things put you at a disadvantage. You're more likely to develop diabetes. You're more likely to develop high blood pressure, and you're more likely to have asthma. So if you live in a neighborhood where it's polluted, right? Some of those of us, for example, that lived in the Bronx, I think we have a New York connection, and Hartford is not that much different in some ways. We have so much asthma, and that puts you at a disadvantage. If you have asthma, you catch COVID, you're in a different situation than somebody who doesn't have asthma. So those are the things that put women, Black women in particular, at a disadvantage compared to their white counterpart. So what can you do? I think that, I think it was Miss Etienne who has already alluded to some of these things, and also I think Dr. James was talking about this, but you have to take control or learn to take control of your own physical and mental health. And there are many layers to that. You have to establish care with a trusting physician, which is not easy. I can tell you that as a healthcare professional, it is hard for me to find somebody that I trust for my own healthcare, right? So that's one thing. And you have to become healthier before you're pregnant. It's not at pregnancy that you try. I mean, pregnancy is a good motivator, but the healthier you are, the healthier you're going to be while you're pregnant. And I think you have to take control of your fertility. Actually deciding when are you going to get pregnant, with whom you're going to have a child, right? If you have, and I understand that many women do not get to make that decision for many different reasons, but that I think taking control of your fertility is very important, and doing all the things we're supposed to do, exercise, eat healthy. But again, there are barriers to that, as I spoke about. Another important thing that we should not take for granted is to vote for representatives that understand what you're going through and also going to pass legislation that's also going to be supportive of you. And you become your own best advocate. There are bills out there that you can speak about, that you can write a letter very easily to your senator, supporting. It might be doula care, it might be extending Medicaid 12 months postpartum. There are different issues that you can support. And then the other thing I think you, especially nowadays, is that you have to have a healthcare advocate. It might be a doula, but you know what? Your mama, your sister, your friend. It doesn't have to be necessarily a doula, but if you have access to a doula, go for it. Because I grew up I didn't grow up. I was trained in a program that we had doulas for patients, and that served them very well. And this was in Boston, at Boston University. And lastly, what I would say is nowadays with this propagation of misinformation, just be very careful about what information you trust. I do, there are a lot of, especially when we talk about COVID, and I know we're going to talk about it perhaps a little bit later, it's like there's so much information out there that puts women and families at a disadvantage in taking care of themselves because they don't know what information to trust, or they trust the wrong information.
Thank you so much for that response. You're so right. It's so important to be able to interact with healthcare providers that you can connect to and connect with. The Links, our Waterbury chapter of the Links works collaboratively with Granville Academy. And we've determined that it's very important for this community to have providers that resemble them, look like them, that come from their community, not just as doctors, but more importantly, as nurses, as physical therapists, as midwives, as ultrasound technicians, as nutritionists. All of those are very important for women of color to feel some kind of connection to those providers. So we've started to expose the 8th and 9th graders in the city of Waterbury, all of the students, to various healthcare professions in the hope that that will pique their interests and get them interested in becoming one of those professionals, and hopefully staying here in our community, because it's very hard actually to encourage people to come to cities like Waterbury that may not be as glamorous as Hartford or as New Haven. And so we found that it's quite difficult to get providers of color, either as physical therapists, nutritionists, just as I said, to come to Waterbury and to stay in Waterbury for extended periods of time when they have the opportunities to work in larger cities that they might find more attractive. So it is a very important, that is one of the most helpful things, I think, to bridge some of the disparities. All right, I'll move on to the next question. While data is not yet available, maternal health disparities are expected to worsen as a result of COVID-19. The devastating impact of COVID-19 on birthing people of color calls for a holistic and multifaceted policy approach that centers on the intersectionality of people of color. Panelists, what political action is necessary to improve Black maternal health? And what can we do to support those efforts around legislation? And this is open to the panel.
Well, I can speak initially and briefly. I think, and it's been spoken upon this evening, but I think part of the issue is this misinformation period that we now live in. We can't even seem to agree that there's a problem. So for me, I think, whether it's on the local level, the state level, the national level, of course. We need to invest in collecting data and to prove that, in fact, these disparities actually exist. And you know, it's crazy to have to actually say that, but in this day and age, you do. So that once we've established, you know, the facts that in fact these differences exist, we can begin to chip away, hopefully, at solutions. But I find that, you know, the discourse begins before there's even a peak or an analysis of the data. So that's my opinion about it. We need to make sure we all agree that there's a problem based on the objective findings that are out there.
I completely agree. And we don't have data from every single state. The CDC is collecting data from some states. And by the way, it does not include Connecticut. We do not have data right now. I had a presentation with the Maternal Child Health Subcommittee, and hopefully that will move the needle towards collecting data for Connecticut. But what we do know from the state data that's being collected is that about 41% of pregnant women or pregnant individuals have received the COVID vaccination. But then when you break it down by racial identity or ethnicity, there's a huge disparity between Asians, whites, and then followed by Hispanics and Blacks. So about, I should say it was not even 41. 41 is Asians, 31% generally speaking. And for Black, less than 16% of Black women are vaccinated against COVID. That's not good. Pregnant women or pregnant individuals are at much higher risk of severe disease. And that includes being 2 times more likely to end up in the ICU, being intubated, 70% more likely to die, more likely to deliver premature. Okay, we already talked about the problem of prematurity, right? More likely to have, then you'd become more likely to have a miscarriage and have a pregnancy loss. These, to me, as a healthcare professional, these are unacceptable risks when we have a vaccine that can help. Now, there are many reasons why people don't get vaccinated. I think there's misinformation, there's mistrust in the medical care, where we do know there's a history of abuse in the system. There's the fact that there's a huge campaign to avoid vaccines in many communities. And I also think that sometimes the message hasn't, oh, I didn't get fast enough to certain communities. So one of the ways, and this is not a solution for everything, but one of the ways that at least I approach it is where I work in our ultrasound unit, we see everyone, regardless of what your race, ethnicity, Medicaid or not Medicaid. So we counsel every single pregnant person on the risks and benefits of the vaccine, right? The risks are very minimum and the benefits are great. And the risk of COVID being big. And I have sometimes a heart-to-heart conversation, especially with my Black patients, about the reason why they're not accepting it. Now, ultimately, patient has, they have autonomy, they decide whether or not they want it or not, but we have been able to change many hearts and get vaccinated right there and then. So, but I think that there was such misinformation to begin with that it's so hard to backtrack and have uniform policy. But we have to write to our senators. We have to ask them to support legislation where they bring clinics to the community, have appropriate masks available, yeah, it's a complex issue and one that is very dear to my heart since I was pregnant during the pandemic, and you know, I dealt with this personally. So
that must have been stressful for you. Yes.
Yes,
Yes.
because it was during the beginning and we didn't know a whole lot about it. And even when I got the vaccine, there's still not a lot of information. But since then, there has been so much information about it. It does not cause miscarriage. There's no increased risk of miscarriage. There's no increased risk of preterm birth. There's no increased risk of small babies, as opposed to COVID, where all of that, those risks exist.
Right.
So.
Thank you so much for your response. Let's see. So actually, you answered my next question, so we'll move on.
I just had a couple of just one thing to add. I wasn't sure what you were going to ask the last question. I apologize for breaking in. I apologize.
No, that's great. Thank you.
Yeah, I just wanted to echo what was previously said by Dr. Pimentel about COVID, and I think from the And we all work together, the pediatricians, the neonatologists, the MFM physicians, and OBGYN physicians. And I think it's important that we communicate. So I'm going to add to the impetus to get pregnant women vaccinated, and certainly women before they become pregnant get vaccinated. I mean, it's very clear, it's effective, it's very clear, as was stated, that there are very little side effects. I can tell you, though, that the women who deliver their babies and have COVID has a serious impact on the babies. I mean, we generally don't offer the mom's breast milk if the mom has COVID. We talked about the fact that they're more likely to deliver early. I talked about visitation, how important that is. We don't allow the moms who are positive to visit initially. So there's that separation. So there's impact on mental health. There's a real impact on nutrition because of the lack of breast milk. It's a huge, huge impact on the babies, not just the moms. And I'll finish by saying there was a recent study, I think it was in the Journal of Perinatology, which looked at women who actually had COVID while they're pregnant and compared them to women who received the vaccine. And interestingly enough, the women who received the vaccine had higher antibody levels than those women who actually had got the infection. So there's just, as we get along, as was mentioned, as time goes along, we learn more and more we're learning that the vaccine is an incredibly important tool during this pandemic. Thank you.
Thank you. I believe a part of the question was also talking about how to get your legislators to advocate. Althea, maybe you can talk a little bit about, I believe that I heard on NPR sometime last week, and I'm not sure if you know for sure, but I heard that President Biden was going to devote a couple $2 billion to research on the Black maternal mortality rate, as well as distributing those funds throughout the states to tackle this problem. Either Althea or Dr. Pimentel or Dr. James, can you comment about that?
I'll let the doctors chime in. I do know back in December, Vice President Harris, on December 7th was her day of action, specifically with a focus on maternal health in this country, which I'm sure moved the president to make a commitment to funding and providing resources across the country to support the effort. She had some very clear outcomes and strategies to really address that. I can put a link to that in the chat for folks, but if Dr. Pimentel or Dr. James like to say more, please do so.
Thank you.
I don't know the specifics of the amount of dollars that are being allocated necessarily, but what I could say is, we already have in the US one of the greatest rate of maternal mortality compared to other industrialized countries. Yep. Mm-hmm. And just in the month of August, during the Delta surge, 40 pregnant individuals died because of COVID. And I don't know what's happening right now with this new surge. We'll see what the data shows. So the disparity, I think, is going to be bigger, wider at the end of these 2 years of COVID. One of the efforts that's coming out of that day of action is actually FACOG and APCO-CREOG, which is the one that deals with the education of residents. They're actually putting together a podcast to educate about vaccine. And this is the first time that I'm saying publicly, but they have invited me to be the host of the podcast.
Oh, that's awesome.
Thank you. So that's one of the ways of sort of reaching out to communities in different ways, but it's meant to give real patient stories because I think we relate to each other as patients. One of the ways that I talk to my patients is telling them, I was in your shoes a year and a half ago. I had to make these same decisions a year and a half ago. I know how hard they are. So I think when we talk on a personal level, as opposed to just data, yes, I'll give you some data, but let me also talk to you on a personal level that makes an impact. So that's one of the things that's coming out of there. They're definitely funding different ways to reach out to the community. And this is one of the ways that, that is going to be done.
Okay, thank you. And my final question, you have all shared some great resources and information on the state of maternal health. How can we as attendees stay up to date with relevant information, resources, and facts to share with our community?
I'll go first. So information is constantly being updated. And my answer to that for mothers that want to stay up to date on certain information, I always suggest first looking at where you decide to birth, look at that hospital information also. Talk to your physician, your midwife or your OB, whoever is providing your obstetrical care. And also there are a few websites that, oh yeah, someone's putting it in the chat. Yeah. So evidence-based birth is also good to add to a CDC and ACOG as well for facts and information as well. And also please lean on your doulas. If someone doesn't have a doula, I did already say Earth's Natural Touch, OEC, if you already are with OEC and working with them. Doulas provide informational support as well and emotional support. And right now, tension is high because people just don't know what to do. They don't know whether to choose left, to choose right, to choose, make choices. So making choices from an informed place is the way to go. So what everybody wants, you want healthy moms and healthy babies, leaving the hospital healthy. So we all want the same thing and the same positive outcomes. And ask questions, please. If you see information and you feel like it's not updated, ask. Please don't be afraid to ask a question, and there's no question that is silly or no question that is not unwarranted at all.
Well, thank you, panelists, for such a lively, informative, and important discussion tonight. We appreciate your time that you've given to this effort and to this event. At this point, I think we'd like to open the evening to questions from the audience.
While you do that, may I just add two things. One is the March of Dimes actually had some, I don't know, I believe they still do, but in the beginning of the pandemic, I did help them with some presentations to pregnant women. They pretty much had like group prenatal care, and those were free of charge. So that's a resource that women can access virtually. And that is very important for the mental health also of women, because we are very much segregated right now. We don't have access to even our family members. And if I bring it back one more thing, if we talk about maternal mortality in Connecticut specifically, the number one cause of maternal mortality actually in Connecticut was actually psychiatric or mental health issues. So even though we think about high blood pressure, diabetes, all that stuff, it was actually mental health issues that led to the number one cause of pregnant women dying in Connecticut. So as Dr. James was saying, pretty much don't take it for granted and take care of your mental health.
What can white counterparts do better to advocate for Black counterparts?
I mean, I think that what you have to do is, first of all, recognize that you are in a position of privilege, right? I'm in a position of privilege as a physician. So also, as your race gives you some privilege, you walk in with already a preconceived, like you've earned something that you perhaps you have or may not have earned. So I think acknowledging that position of privilege and being there and understanding that, again, this is not race, it's racism. It could be structural, institutional, personalized racism, understanding that. And really being for a position, advocating via legislation, advocating at your local level, advocating at your hospital, and checking yourself. We all have biases. I have my own. We all have them. And check your own biases and try to do better every single time.
Yeah, I'll add to that. I mean, I think the part of it, as I see it, for me as a professional, is the part of the onus is on me. There aren't many of us, people of color, and particularly in medical leadership positions, unfortunately. But what I try to do is try to raise the awareness and just ask questions. I mean, again, I think the political discourse these days is just ridiculous. I mean, it's just crazy. But yeah, we're not calling you a racist because, you know, we're all victimized by structural racism. I'm victimized occasionally by structural racism because it's part of the structure. It's not my own personal view. So anyway, I do think that, and I'm sure Dr. Tejeda, Dr. Pimentel do that as well, is, you know, ask the questions of our colleagues and try our best when we see something, say something and point it out. And I think that's in a small way important to do to move us in a better direction as a profession.
Okay, thank you. I do have a question from a father in the audience. He says, how can fathers help mothers during this specific time period? And how do we get more involved? And maybe, Chelsey, I'm going to give you that question because you've had 3 children, and so you've got lots of experience on the labor process. And so I think that you are uniquely qualified to give us your insight on how fathers can be more involved.
Absolutely. Thank you so much. And what I think is the way that fathers could be more involved is more so just standing up for your child's mother in the processes of, you know, before birth, during the birth, and after the birth. For moms, when we're going through that process, our brains are kind of scattered. We're all over the place. You know, and so as a father, I think it's just important to be there and say, you know, hey, she's saying this, I need you to take action. You know, hey, she's saying that this is bothering her, I need you to pay attention and listen. So I think just being that strong support system for your child's mother going through that process is amazing. And even now, while we're in the pandemic, where like the doctors have mentioned, there's a lot of mental and emotional things going on, you know, that even compound upon regular hormonal changes within a woman during, you know, pregnancy. I think it's just important to be very gentle and to have patience, and again, be loving and supportive. And you know, sometimes moms cry. And we need you to realize it may not be you. We're just sad, you know, so we also don't want you to feel like, you know, we're blaming you or it's your fault. And so we just really need that patience and that kindness and understanding. And so I think just being that strong support for her, you know, during those times is a big help.
Okay, very good. Thank you so much, Chelsey, for that response. I have a question from someone else in the audience, Dr. Kalila Brown-Dean. Oops, your question just went off my screen. Here we go. Sorry. Hold on. Oh, I'm sorry, I'm just having a hard time. All these things are popping up and it's clouding the question.
Dr. Tejeda, would you like me to help you during this time?
Okay, yeah, here it is. Okay, how can employers better support their employees who are navigating these experiences?
Do you mind if I answer that, Dr. Tejeda?
No, go right ahead.
Okay, so what I want to remind everyone is that perinatal mood disorders and postpartum depression is not something that is solely isolated to those first 6 weeks postpartum. Mm-hmm. It can happen up to 1 year. Mm-hmm. So I think as an employer, as a mom, a grandmother, anyone that's in sight, and people spend a lot of time at work. So you can imagine someone's at work for 40, 50 hours a week. They need to know that they can be flexible. They need to have support postpartum with, by law, also with having a room to breastfeed if the mom is feeding her baby in that way. They also need to know that there is a family medical leave available. So just providing information with what the company can provide, and also just being empathetic. Mm-hmm. Sometimes people need to hear, look, I know you just had a baby. Don't worry about that last email. I'm going to look at it. Sometimes people just need reassurance that they're doing okay and that they don't have to go crazy at home and come to work and then leading to other mood disorders that can be fatal. So reassurance to answer the question, support on the facts of what the company offers, and also being an empathetic human to that person.
Thank you so much. There's another question here. How can I avoid another Black mother in a horrible situation, as I am currently 21 weeks? What questions should I be asking?
First, I want to say that even though we're talking about there is a crisis of maternal mortality, you know, most women give birth and they're fine. I don't know how else to put it. Like, you know, there is a crisis, but most women give birth and they are just fine. But it's knowing what fine is or normal is and what abnormal is. So I think first you have to educate yourself about what are the expected things of pregnancy. I don't even call them sometimes normal anymore. You know, back pain does not of it. But there's normal back pain, there's kidney stone back pain, and there's something else, right? So just knowing the symptoms, knowing what's normal, what's expected. There are books that are very much easy to read. There are now apps that you can find. Most hospitals have their own apps and you know what to expect week by week. So educating yourself generally about what it is and not so much always relying in our community, because we all grew up in communities that tell us things that are just not true about pregnancy, including myself. So there's a lot of knowledge in the community, but there's also a lot of misinformation sometimes. But then also knowing what the abnormal is. And I'm going to put a plug. Actually, the CDC has this one that says basically it's not so much for the expected person, but for the support person. This is something that the fathers can read about, or their grandparents, is basically symptoms to watch for. Symptoms of things that are concerning, symptoms that may be concerning for, you know, heart failure, concerning for a pulmonary embolism, concerning for your blood pressure being very high. So if the person is experiencing that, you can dial the phone and call the person's OBGYN or midwife and say, hey, my wife, my daughter's experiencing X, Y, and Z. So that, I think, educating yourself, generally speaking, when you know what's expected, and something doesn't feel right, then you can voice it, and hopefully having a support person that can be there for you. I think that fathers are not spectators. It's very hard sometimes for men to manipulate, not manipulate, but to be in a hospital setting, especially for obstetrician-gynecology. They can't quite find their space sometimes. It's very intimidating, but your job is not one of being a spectator. To me, your job is being a supporter. And part of being a supporter, again, is learning about what's normal, what's expected in pregnancy, so you can know how to advocate for your partner. And taking classes, these classes with the expectant mom or the expectant person, these pregnancy classes, that way you learn and that way you can advocate.
Okay, excellent. Another question.
I had a little.
Yeah.
Oh, okay,
No,
sorry. Go ahead.
Yeah, I just wanted to piggyback off of Dr. Pimentel. She's absolutely correct as far as, you know, not being spectators. But what I wanted to mention was to also not be intimidated when you're in those spaces and that you know something is going on. So, you know, for example, for me, I knew that I didn't feel right after one of my pregnancies, but I got sent home anyway because the doctor said that I was fine. And not even a week later, I was in the hospital, hooked up to magnesium sulfate, and I couldn't even get up to go to the bathroom. So when you know that something is wrong, just stand firm in that and say, can you just check again? Can you, just run the test again? Just be, patient and take that extra few minutes with that professional, just to let them know, hey, I know something isn't right, just so that you don't experience something, that could end up, in tragedy.
Thank you.
Yeah,
Dr. James?
I'll just quickly add, just wanted to echo Dr. Pimentel's discussion about healthy babies. I mean, I'm a neonatologist, so my main focus is the babies who have trouble, but remember, it's, at most it's 9-10% of the babies end up in the NICU. The vast majority of those babies are there for less than a week and do well. I spent most of my career spending time in the well nursery, so I didn't forget what a well baby looked like. and to reassure myself that in fact, wellness is predominantly what we see in obstetrics. And just as the lone guy on this panel, I appreciate the questions about men and the fathers. But I would also seriously say, I think it was mentioned earlier that it's important to have a support person. I think one of the roles of that support person, whether it's a husband, a partner, or whomever, is to join you on these prenatal visits. Because I mean, often I've been a patient, and I know when I'm a patient, I'm anxious. My ears don't work, my brain's not working as well. But if I have a second person there listening to the same explanations, I'm more likely to understand it, because that person will say, well, no, the doctor said X, Y, and Z. So I would definitely very much echo the prior thought about having the support person there during those prenatal visits to hear what the doctor's saying so that they can reinforce it as well.
Thank you for that. I did see a question from Lakeisha Rivera. Hello, Lakeisha. She had a question that she wanted to know, how can we get non-people of color that sit on boards or executives in large corporations, C-suite, how do we get them engaged in this conversation and engaged in helping support getting better health for Black women and decreasing the Black maternal mortality rate? And I'd like to, perhaps Althea, you might be able to chime in on this, since this is exactly what you're doing. I'm sorry to put you on the spot a couple of times. I know you're not on the panel, but
That's okay, Dr. Tejeda-Smith, that's okay. So that's the work of Bridge to Success. We are the backbone support for the community of Waterbury. And so our role is really to bring a cross-sector representation of stakeholders to the table, those with lived experience, those working in a variety of systems, whether that's healthcare, municipal government, corporate America, to be investors, partakers, contributors to the work. And so that's the role that we play, which is why we're here today. And we have Trinity Health at the table. We have Stay Well. We have the partnership with Greater Waterbury Health Partnership, which is also doing similar collective impact work. So a lot of it really is about data-driven. We talked about that at a previous presentation, seeing where the gaps are. And as the backbone support to the community, we identify those and then seek out the partners who can help us address them.
Thank you. Thank you so much. Thank you, everybody. Thank you so much for your participation. It was a very lively discussion. And so now I'll turn the tables over to Cheryl and Althea. Thank you.
So again, thank you all so much. Our chapter member, Dr. Marcia Tajeda Smith, our connecting link, Dr. Edward James, Dr. Veronica Pimentel, Farrah Etienne, and Chelsey Harris. We'd like to thank you for your time and your expertise. It is much appreciated, and this is such a very important topic. I would like to thank Bridge to Success, the Health and Human Services Committee of the Waterbury chapter of the Links Incorporated, the American Heart Association, Stay Well Health Center, Greater Waterbury Health Partnership, and St. Mary's Hospital for all of their time and effort for making this evening's event a great success. And most of all, we would like to thank all of you. We would like to thank you for your time and for your attendance this evening. We invite you to come to all of our upcoming #Day 43 events. And Althea Marshall Brooks will now share some of those upcoming dates with you.
Thank you, Cheryl, and I echo those sentiments to all of our partners in this work and to all of you. So this is just the beginning, as the title of the webinar was setting the stage. This is not a one-off for us. This is a campaign for change. This is a campaign for transforming systems so that we can begin to see better outcomes for Black women, Black birthers, and babies, not only in Waterbury, not only in the state of Connecticut, but in the country. If I'm not mistaken, Vice President Kamala Harris is a link as well. Well, we have partnership at the White House. I'm going to claim that and I'm going to speak that. So I'm excited about what that means for us. And we had begun planning this before she even announced on December 7th. So we have, all the stars align when they need to. All things work together for the good.
Right.
So we are excited about this work. And so what's coming up next? On February 12th, we have a call out for all Black mamas. It is the weekend of Valentine's Day, and we will be celebrating and loving on Black mamas in Waterbury and their children. It'll be a day for us to pamper them, support them, to lift them. It'll also be an opportunity for them to meet the partnership that's supporting Day 43. They'll walk away with that health information that's extremely important so that they can be healthy and well and thrive, as well as their children. So please share about the calling out for Black mamas to come and be a part of the citywide photo shoot on February 12th from 10 to 1 p.m. We'll feed them as well. We'll be providing childcare and, as I said, resources. So please share this information with any Black mamas or Black birthers you know in the city of Waterbury or the greater Waterbury area. In addition, our next event will be February 22nd, and we are excited about that. More information to come. February is Heart Health Month, and you heard some really interesting data and impact of the issue around cardiac health in Black women. So we are going to make the most of the month of February really to lift that, to focus in on that. And we will have an exciting webinar for you. Again, hold that date, February 22nd, more information to come.